I'm your host, Dale Sherbeck, and welcome to the HQ podcast. For those tuning in for the first time, the HQ is a podcast serial produced by CHA Learning and is your trusted source for important conversations on healthcare issues and topics from those that are leading and impacting the health system. Together, we'll explore these topics as we continue to learn together. CHA Learning is the professional development division of Healthcare Can and is uniquely Canada's only national fully online learning provider serving all of healthcare. So please check out more about our learning programs and services after this episode and discover how we collaborate with health leaders and organizations like those we feature on the HQ to empower healthcare professionals with the knowledge, skills, and relationships to impact health system improvement. So thank you, listeners, for joining me today for another amazing conversation. This one is going to cover an existential topic that matters to us all, planetary health. Most, if not all, listeners have some appreciation for what we mean by climate change. But what about planetary health? What is it? How is it different? And why does it matter to healthcare? After all, most professionals working in the health sector care intimately about health. The profession writ large wants to help people and positively impact their health. And indeed, most of us are familiar with that most famous of medical axioms, first do no harm. So imagine the moral distress of healthcare professionals who learn that the health system itself is one of the greatest harmers of our planet's own health. Well, we started this conversation last year by having a panel discussion specifically about the role of procurement in planetary health. The conversation is certainly much bigger and continues to get bigger as many other narratives and issues that need to be explored emerge, especially as we try to mobilize our health workforce to be a change maker in this space. I know that to take this on or even to have a conversation or listen to this one are not easy tasks because, as I'm sure many of you can relate, the news so often seems just so dire. And many just feel entirely overwhelmed by the prospect of what needs to be done and how far we need to get to save our planet so that we ourselves can continue to exist on it. Whatever path forward we will take, planetary health will continue to require strong leadership, which is why I'm very grateful to be joined by Dr. Husein Moloo. Husein is a colorectal surgeon who has a background in QI and patient safety and came to appreciate planetary health through its intersection with QI. He is the inaugural director for planetary health for the Faculty of Medicine at the University of Ottawa, where he is also professor. He is also the advisor on planetary health to the Royal College of Physicians and Surgeons of Canada and co-chair of the Association of Faculties of Medicine's National Planetary Health Committee. So hi, Husein. Welcome to the HQ, and thank you for sharing your leadership on this existential topic with all of our listeners.
Thank you, Dale. I really appreciate you inviting me on this show, and it's a privilege to be here.
Yeah, thank you. So we're framing this as a conversation about planetary health today. So maybe we can just start with some sort of level setting and defining, like, what do we mean when we talk about planetary health?
Right. So I guess the first thing, Dale, for your listeners to know is I'm a pretty simple-minded guy. So if you look up planetary health, you'll see a lot of different definitions, and they're great. There's a lot of great definitions out there. But for me, I like a fairly simple definition in my head of planetary health, and that is this notion that for the people that we look after to be healthy, they need clean food, they need clean air, they need clean soil, they need clean water. Without those things, they will never be healthy. We rely on our ecosystems, and I think the other really important notion that I like about planetary health is, and it actually is, and I don't want to ramble too much here to start, but planetary health, it sounds new, but it is very much what Indigenous people have been living for thousands of years already.
Mm-hmm.
And their notion of 7th-generation thinking is part of this planetary health philosophy where, the people we look after today, they're really important. And that doesn't change, but I think our gaze needs to kind of shift to future generations as well and think about the legacy that we leave behind and the ability of future generations of people to be healthy. And we need a planet that that has intact ecosystems to be able to do that.
Thanks. And I appreciate your passion, certainly in the conversation that we've had previously, and the way you frame that for us here today. So maybe starting with your passion in terms of, what is the spark, right, that brings you into this realm? Like what made planetary health a topic for you, a passion, and how did you get involved in this work, and why?
Yeah, I mean, I wish I could tell you I had a really smart master strategy, but I'll tell you kind of what happened. I think it's maybe a feeling that a lot of people can relate to is that you look at what's happening. You see the news. I mean, you see now what's happening locally. I mean, I think anyone who is listening to this podcast, all they need to do is reflect on the weather that they've experienced over the last 10 years, 15 years, 20 years, whatever that time horizon that they can reach back to and access. And I think for many of us, and I'd love to hear from the listeners who maybe this hasn't happened to, but I think for many of us, the weather has changed.
Hmm.
Um, climate crisis used to be something that we would see kind of affecting other countries, but I think it's really starting to hit home now. Especially in Canada, we're seeing that all over the place. In Ottawa, where I am, the Rideau Canal. I mean, it's been open for like 4 days over the last 2 years now, and I don't see that trend changing. Um, the extreme weather events, we get tornado warnings all the time here now. We had tornadoes last year in Ottawa. We've had a Draco. And I mean, wherever you are, I think you can look at those own experiences. So I bring all that to say, when you reflect on that, there's a certain level of anxiety that probably comes with that. And for me, that was definitely there. And sitting there as someone who's very privileged in terms of my education, in terms of my socioeconomic status, I can sit there and I have this luxury of being able to advocate for this. And so that was there, kind of this realization that like, who do I expect to be doing things if I'm not doing stuff? And I know there's a ton of people out there doing things. That's one piece. I look to my daughters, who obviously they care a lot about this stuff.
Hmm.
And then when they're looking at me, what am I doing about it day to day? And at one point in time, is wasn't anything intentional. And so I would say that that really was the nidus for all this. And if you'll permit me to ramble on more, Dale, is that okay with
Yeah,
my answer
please.
here?
That's why we're here.
Uh, so you start with that, and as you mentioned in my introduction, I have a background in quality improvement and patient safety. I love QI and patient safety. It's great, and it enables us to really kind of affect a lot of people and a lot of care. I was leading that for our Department of Surgery, and we concentrate on stuff in the Department of Surgery, like surgical site infections and mortality and readmission, which in retrospect, actually, if you improve those things, that's planetary health as well, decrease our carbon footprint, but wasn't doing it intentionally. And so we were trying to engage our different divisions as time went on. And we started looking at things that were affecting society. So the opioid crisis was affecting society, and surgeons are not responsible for the opioid crisis, but we looked at, could we reduce opioid prescribing from surgeons in our department? And that worked really well across all our divisions.
Hmm.
And then, we're sitting here one day and we're like, oh, the climate crisis, and started looking into that. And that's where this whole, kind of learn about planetary health. And so that's really where it all started from, was kind of, I think it's on all our minds. And then all of a sudden I happen to be sitting in an infrastructure that exists pretty much in all our healthcare system, which is quality improvement and patient safety. And then realizing that we could intersect these two things to actually start start somewhere.
Okay. So, what is that intersection then? So, for you, I mean,
Yeah.
and why do those two things fit together?
Yeah. So as I started reading about things, and there's fantastic resources in Canada. I'll point to something like, there's an organization called Cascades. They have great educational material. And I remember speaking to Fiona Miller and Nicole Sims, and they were like, have you heard of this triple bottom line? And I was like, I haven't, and they sent me this paper, and basically, so for those of you who don't have a background in quality improvement, again, I have a simple mind, and people will maybe take exception to me breaking down quality improvement into equations, but the traditional equation to me for quality improvement is you have, if you can imagine a fraction, and the numerator is patient or population outcome. And on the
Okay.
denominator, it's economic cost. So if you keep, let's say, a patient outcome the same, but you decrease cost, your fraction gets bigger, that's quality improvement. Well, this paper in the Harvard Business Review originally that was published, and then it was adopted by the NHS actually and used, is something called the triple bottom line, where they said, well, wait a second, there are things in society that are just as important, arguably, as economic cost. And so while patient or population outcome remains in the numerator, on the denominator, should we consider other things? So economic cost still remains there. It's still really important. But can we include social accountability? And can
Hmm.
we include environmental impact? And so those three things, economic cost, social accountability, environmental impact, form this triple bottom line. And I think, once you kind of take a lens that incorporates that, then interesting things start to happen, in terms of the way you approach certain issues.
Okay, that's great. So why does that matter to healthcare? I mean, apart from the impact of the patient, sort of
Yeah.
that equation that you're describing. I mean, where does healthcare fit within this larger context about planetary health and its impact?
Yeah, no, that's a great question. So um I think, one thing that I wasn't aware of, and still I think, more and more people are becoming aware of, but a lot of healthcare professionals maybe are not aware of or thinking about, is that, I mean, everything we do in healthcare has a carbon footprint, right? And so generally, not always, but the more something costs, the more intensive it is, the bigger the carbon footprint. And when you take healthcare as like an entity worldwide, in terms of carbon footprint, it would be the fifth biggest kind of country in the world in terms of carbon footprint. And so, I think, when we look at that, all of a sudden we're like, wait a second, like we have this massive kind of contribution to what's going on in the world, and so can we start mitigating that, thinking about it, because I mean the climate crisis here, and we also have to think about ways to adapt our healthcare system. But in terms of intersecting that fact with now this triple bottom line, you have, and you superimpose on that the fact that, like, the vast majority of our healthcare professionals and healthcare providers are similar to the majority of adults in our Canadian population and actually worldwide, and the fact that they find this to be very distressing. Like, a lot of people have this eco anxiety, right? And one of the antidotes, and of course it's multifactorial, but one of the antidotes, to eco anxiety is eco action. And
Hmm.
so if we can take all these things and intersect them, then all of a sudden, we can start doing kind of cool things.
Yeah, I love the those terms about eco anxiety and eco action. So, um, yeah, so how do you break through that? I mean, how do you know get past that inertia, the anxiety, which scares the crap out of so many of us, right?
Yeah.
I mean, we want to do better. We know that we have to do better for ourselves, for our children, you know for those other generations. I think, as you described it at the outset. Um, how do you engage people to do this?
Yeah. It's so I'd say, so it can be tough. That first step, I think, can be tough because when you think about it, it's such a daunting thing, right? And there's so many different pieces at work. But I think at the same time, if we think about any of our environments where we are, work environments, there are so many opportunities. And so, to give you an idea, for example, I was talking earlier about our Department of Surgery quality improvement, intersecting that with this triple bottom line. And the things we traditionally worked on, like I said, surgical site infection and stuff like that. But our project that we took on as a department was, because we took this triple bottom line, was looking at changing from paper faxing to e-faxing. And the e-faxing technology was free. It was already offered by the hospital. It just, the Ottawa hospital is a big hospital, and not everyone's aware of this. And so we had a urologist who had led this in his division, and so kind of worked through the kinks of that, worked with his admin assistant. They actually created some videos, and it was amazing. Like, we had our divisional QI leads buy in to to kind of addressing Planetary Health as part of our kind of QI, quality improvement, kind of vision. And uh and it was amazing how it took off. And you might say, well, it's like not that big a deal, but my office alone was using 55,000 sheets of paper a year. We know a pound of paper, the amount of energy that goes into producing that, is equivalent to a pound of steel. It's better for patient safety. It
Yeah.
costs less for the office in terms of toner. So when you start kind of putting stuff into that kind of equation of the triple bottom line for quality improvement, it's safer for patients on the numerator. On the denominator, it's cheaper, it's socially accountable, it definitely is better. And from an environmental impact, standpoint, obviously, like the shipping of all this stuff, the production, et cetera, it's way better. So we had this easy kind of triple bottom line win. And then you kind of, and then it's funny, things just kind of roll from there. People start thinking about this stuff. It's in all their offices. It spreads the rest of the hospital. And people have great ideas, right? So, if you're by yourself considering where to go and you don't have this yet, there's a lot of people out there who want to do stuff. And it's just starting with something that is kind of like low hanging fruit, and taking that first step. And then I find it kind of snowballs from there.
But I think that it's interesting, and maybe we could sort of, you know, unpack that a little bit more, Hussein. So, I mean, you don't have a specifically, you know, an executive leadership role at the hospital, right?
Yeah. Yeah.
You're not the CEO, right?
No.
Right. You are, uh, a professor at the University of Ottawa, right? You have privileges at the hospital.
Yeah.
Um, So how are you making this work when you're not you're in a distributed leadership model, right? At some level, right?
Yeah. Yeah. That's a really great question, Dale. Thanks for asking it. One thing I kind of talk to, uh, especially actually to faculty, but as well as like, trainees, is there was another really interesting article in the Harvard Business Review. I think it was around like 2013. And it talked about making change in the NHS, so that, the system, the health system in the UK. And what they found was that the change that was created, a lot of it was created by people who are not in formal kind of high in the hierarchy type positions.
Hmm.
Where it came from was more of this informal leadership with people who had a good network, and not a network that was, and I can't remember the type of network it was called, but there's networks where, let's say, me as a surgeon, my network is just all like surgeons and, let's say, maybe nurses and trainees in the perioperative space. But I've been fortunate to have this other type of network where, yeah, like, I'm old, Dale, so I've been around for a while. So I have a network of, like, I know senior administrators, I know the CEO. I like, there's a lot of people, a lot of nurses, a lot of clinical care leads, directors that I know in different areas. And so with that, let's call it a distributive network. Um, you can really drive change, and the literature supports that. And you may say, well, okay, I'm not someone who has that network right now. Well, guess what? All you need is to know someone who has that network. And as a very quick example of that, I'll tell you, I had this incredible medical student who worked with me. And if you're in any kind of hospital, say, medical students don't have any kind of real power or know many people. They're in school for the first 2 years. She came and spent a month doing a leadership elective with me. And in that month, she was able to, I was able to connect her with people in procurement here. And to make a long story short, the Ottawa hospital is switching over the 273,000 disposable gowns it uses per year to reusables. And that is based on Niev's, again, the medical students' work during that month. That's a pretty significant contribution. Not only that, the slide deck that she put together is something that has been distributed in our Ontario kind of surgical quality improvement network, where we have a 45 hospital collaboration that's working on something called Cut the Carbon.
Hmm.
And that playbook that she kind of created from her slide presentation to senior leadership here has been distributed to all these hospitals. And so just to say that kind of finding these opportunities, like I said, is everywhere, and then kind of harnessing the network that you or someone else may have to drive these changes.
Yeah, so using your social capital obviously, yeah, is critical, and not being sort of guarded and possessive of it. Use it for the maximum benefit. But I mean, how do you? I guess there's a cultural aspect to what you're describing. There's something that's embedded or exists that where yourself or a med student, right, feels comfortable, capable, of bringing forward an idea and sort of seeing that happen. Like, what are some of those um, conditions, I guess, that need to be in
Yeah.
place for that to happen? Or and how do you and have you had an opportunity to influence those yourself?
Yeah, so again, you bring up a really important point, and you're right. Like, could this happen in an environment where none of the leadership kind of cared about this? And I'll tell you, like our head of procurement here for the Ottawa Hospital is really invested in trying to um have a planetary health lens to the stuff she does. She's great, Tracy Dennis, and now we have a sustainable kind of procurement group that started meeting. But also, I have to give credit, like right from the very top, our CEO Cameron Love, he's been very open to, like, again, like I don't have a formal title within the organization. Yeah, I've been around a while, but he's met with me on several occasions to chat about this. There was a group of three of us that presented to the board of directors and about the importance of planetary health. And and if I boil the kind of that down in terms of the what we present to leadership, or what I present to boards of directors or department heads or CEOs, the message is actually really simple. It's climate change is the number one threat to the health of humanity,
Hmm.
as recognized by multiple international health organizations. If we are in the, or if an organization is in the, business of the provision of healthcare, or the, educating healthcare professionals, then how can the vision and that mission for that organization be relevant without including planetary health, considering local, provincial, national, international contexts? And again, I'm a pretty simple-minded guy, and there's like people on this. I hope there's some people that listen to this podcast, and I'm sure some of those people have much more complex designs in their brain compared to me. But to me, it really is that simple, and that's what we presented to the board of directors. So I've had conversations with our CEO about, and again, with that forward-thinking type leadership here, planetary health is on the strategic plan of the Ottawa Hospital now. If you look at the poster for the Ottawa Hospital strategic plan, dead center in the middle of that poster is you've got a healthcare professional listening to the globe with a stethoscope, and that's planetary health.
Yeah, I mean, it makes sense, and I don't. I guess I wouldn't underestimate the power of converting complex topics or issues into simple words, right? That people can get behind and internalize. So I think that's an important strategic strength for sure, to be able to help harness that and communicate it in a way that people can understand it. Um, so yeah, I mean, I think kudos to you in terms of your involvement in that, Hussein. Um, so did you receive, I guess, pushback, or have you received this resistance? I mean, in that space that you've tried to find ways to sort of navigate to bring some of those resistors um, uh, into your team?
I think so. I think the vast again majority of like people in healthcare, and again, there's surveys to show that the majority, significant majority of adults, and certainly the percentage increases as we move towards younger age groups who are more affected by things such as the climate crisis. And let's remember, I keep on bringing up climate change, but there is really this triple kind of crisis that's affecting the planet. There's climate change, there's pollution, and there's loss of biodiversity. These are all like significant crises that are ongoing. So I think,
Hmm.
the percentage is high for people to kind of realize this is an issue. Then once they realize there's an intersection with health, I think most people are they're on board philosophically. Like they understand that this is important and should happen. I think, I wouldn't say resistors, but let's call it, people who are being very pragmatic about this. And it's really important actually, is to say like, yeah, we can try and do all these things, but actually, when we think about that triple bottom line, economics does really matter, and we are in a strained healthcare system. And so I think that's really important. But the good thing is that generally, again, green care is kind of it is it's economically good care as well. One of the things we often point to when we're talking about planetary health is that, within healthcare systems, that like 30% of the care that is provided is kind of useless care. And out of that 30%, like 20 of that 30% is harmful. So again, when talking about things that we can do, emphasizing like appropriate care, and like choosing wisely, Canada has come out with they've embedded planetary health as one of their pillars, and they've had a bunch of societies just now write in with recommendations for choosing wisely. And so we have all these, like I said, I think we're really, as all these things are really now visible to people as opposed to being remote. I think we're really in an environment right now where more and more organizations are really kind of pushing this, getting this on board. There's a lot of resources. And there's again more and more evidence to show that if you are offering sustainable care, that aligns very much with, you know, improving the cost of the care that we are providing.
Yeah, I guess part of what makes is that I'm processing what you're describing here and thinking that common to a lot of what you've been sort of synthesizing, I guess, is a systems approach to looking at how healthcare works within a larger. I mean, healthcare is a system itself, fair, but it works in these larger sort of ecosystems. If I can, I guess bring in a bit of
Yeah.
a pun in that, and so. I mean, is that one of the challenges that you're trying to sort of do, or even you're reflecting on your own journey and the way you've looked at this through that system lens? Because I think certainly there's lots of people in all industries, and healthcare is not any different, where people just sort of focusing on process, delivering tasks, just doing what I need to do, in
Yeah.
the absence of how it all connects together. So, any thoughts on that?
Yeah, no, thanks again for asking that. I think so the way I kind of think about this, as you mentioned, like system level changes. I mean, that's really where things are at. If we want it, because we need transformative change, right? Like this decade is really important. It's almost half gone. Um, so we need transformative change, and we need it done efficiently. Um, I think harnessing infrastructure that exists is really important because then we don't have to create totally brand new infrastructure for everything. So that's one thing, which is why I like the QI stuff. But I also think as we think about these different changes, we do need to think about them in terms of a micro, meso, and macro level. And so, to your point, so at the micro level, that's kind of like our, on like a, person to person thing, or maybe at a unit level. The meso level is more at a organizational type level, and the macro level is whether it's provincial or a national thing or international thing. And you're right, it's there's there's so much to do, but I agree. Like, so when I kind of think about this, and when I'm talking to people, is like, I think the easiest place for most people to start off with is to start at a micro level. But if we're thinking about right from the beginning that, listen, like, we really need transformative change, then very quickly we think about meso and macro levels. And to give you a few examples of that, so we talked about our department of surgery, kind of thinking about planetary health. Well, we started with one simple project, but then, I was talking, like I said, to these great people at Cascades, like Fiona Miller and Nicole Sims, who are, really great in giving me advice and mentoring me. And then, then we have this 45 hospital collaborative of in Ontario. So does over 70% of surgery in Ontario, has all four children's hospitals part of this collaborative, and it works on quality improvement initiatives. So kind of went to them, their executive, again, great leadership there, like Tim Jackson and Pierre and so, kind of pitched this to them. They're like, okay, you know what? This sounds like something that can really engage people coming out of the pandemic and really, kind of get people going again in QI stuff. And then presented, we need to, as a collaborative, we always decide as a group what we're going to do. So, presented us as surgeon champions. It's a perioperative group, so there's surgical clinical reviewers, et cetera, et cetera. Present all this, and the collaborative buys into this. So now all of a sudden, you go from one, let's say, department of surgery working on this to 45 hospitals perioperatively. So this is like anesthesia, surgery, nursing. You have administrators all thinking about planetary health, and this was the Cut the Carbon campaign. And it kicked off in 2023. And, you know, speaking to the leadership at Ontario Health, there has never been so much engagement around a particular kind of theme, because we have these themes every 1 to 2 years. And there was so much engagement that it got pushed into, got extended to a second year. So that's on like the kind of, trying to embed these different things. And there's a menu of options with playbooks that, again, were created in collaboration with Cascades, because, they're experts in this space, to kind of, again, take advantage. So we're not trying to, kind of recreate the wheel there. And then, another example, just kind of switching gears, is, education is really important. I mean, people talk about education being a vehicle for social change. Um, you know, to educate healthcare professionals and our trainees about this is really important. So, the CEO at the Royal College had a similar conversation like I did with the CEO of the hospital. She was very engaged with this. Planetary Health is now in the strategic plan of the Royal College of Physicians and Surgeons of Canada. I think that's a very powerful thing in and of itself. But all trainee kind of learning tracks back to something called CanMeds. CanMeds is a framework that kind of, all these programs. There's 100, medical and surgical programs housed under the Royal College of Physicians and Surgeons of Canada. All of them track back to CanMeds in terms of accreditation processes, what trainees need to learn. And the College of Family Physicians of Canada also uses it. And there's a bunch of international organizations that use it as well. So again, we got, again, buy-in that Planetary Health will be incorporated now into CanMeds. So now all of a sudden, we have this kind of win there, where now, like, we change that right at the top level of the system, and it's going to affect, basically what that practically means is that once the new edition of CanMeds happens, every trainee in the country is going to need to learn about planetary health, and the accreditation of the programs will depend on it. So, two ways of saying that, like, again, micro, meso, macro, and you can look at that in terms of, like, can we do that in procurement? I know, like, can we do that in other ways? And yeah, I think we can. It's going to just take people in each of those areas to make sure that these things keep on moving forward.
So, I mean, I'm sure our listeners can sort of hear the passion and your excitement in your voice as you're talking about something. Like, I get a sense that, this is one of the reasons you get out of bed every morning to do work. Um, so, but I think as you're describing some of the work that you've been doing, and the engagement, I guess, of staff in terms of working on these issues together, you know, does create, I guess, cultural engagement or workforce engagement sort of across the board. I mean, have you seen a change in terms of, morale or, staff engagement, across the organizations you've been working in. How does that how does that battle, I guess, some of the, as I sort of described at the outset, around like this moral distress that so many within the health professions are have been facing for a variety of reasons.
Yeah. So again, another great question, Dale. I can see why you're hosting a podcast. Um, you know, so I have no formal data to say, I have done a survey culture wise, pre implementing some planetary health stuff. And I have another, survey of culture to say that people feel better. So I don't have any of that. And certainly the conflict of interest is like probably people who are coming to talk. We get occasional people who are complaining about, the gowns changing from disposable to reusable and they prefer the disposable gowns. I get some of that, but generally, what I hear from people is their ideas. Like I get emails about people's ideas. I get emails, from people or chats with people saying like they're just really excited about trying to do something. Talking to trainees about their projects and they're implementing stuff and they're excited about it. So I would say overall, like when we, let's say the faculty of medicine here, when we look across the board and we look at all these different activities which we've tried to implement, we feel there is this kind of almost palpable excitement from people around this topic in terms of wanting to do things. And when I look at, other organizations, like I said, like, we look at that provincial collaborative in Ontario and people saying like, there's never been so much engagement around a topic. I look at the Royal College and the people I've worked with there who are fantastic. And, what they said is like, the stuff that's happened, like, let's see with Planetary, like the Royal College is a big organization, like I don't know, like 55,000 fellows. There's like 12,000 trainees, but the kind of speed that some of this stuff has happened and planetary health ending up on the strategic plan, like these are all things I think that give people some hope. You look at the AFMC, for example, and their pledge for planetary health, and now we have a dean-appointed planetary health lead from every faculty of medicine in the country, and so can this stuff start to again continue to build momentum, excitement, but most importantly, change? I think it can. Do I still wake up with these feelings of eco anxiety? Like, absolutely. But does it help me look my daughters in the eye a little bit better? Yeah, I think it does. And I think like one story I didn't share, but like I like I just got into this area, let's say planetary health, about like I don't know 3.5 4 years ago now.
Hmm.
Um, and at that time, my kids were doing an extracurricular, and it was all about like they were trying to motivate these kids to be like, think about the important things in society, like think about the big questions. Who's going to tackle these big questions, like world hunger and the climate crisis and loss of biodiversity? And they're like, they used doctors as an example of people who are smart but get into a niche and they do important things at niche. Like, don't get me wrong, like, and they're saying don't get, but like in terms of intersecting with the really big questions that are like existential problems that we have now, because
Yeah.
I think the climate crisis truly is an existential problem. They're like, look, those people don't engage with that stuff at all. Hey, I thought about that, and that's like, that's really interesting. And I think a lot of people in healthcare, providing healthcare, there's a lot of smart people. In fact, smartest people I deal with are usually not doctors, to be honest with you. And so, it's kind of like, yeah, wow. Like I think there are ways. And listen, we're all at different places in our careers, personally, professionally, in terms of what we can do and the amount of time we have to put into stuff. Um, but I do think even small intersections with stuff like this can bring a lot of fulfillment. Um, you said like, yeah, like this stuff means a lot to me. I find it very fulfilling. It's interesting. Like if right now, if you said to me, like, look, you have to pick between doing surgery or doing planetary health, it actually is a pretty easy decision. Planetary health right now, it is like all of it's very fulfilling. I love it all. Like I feel like I'm really happy, but like if I had to continue with something right now, it would be planetary health because it helps me intersect with some of the stuff which I think is really important.
Yeah. Well, and it's I always come back to a quote that I heard Peter Senge provide, from a system sort of perspective, right? And as he's talking about why a multinational company sort of should be caring about, you know, our fisheries and oceans and fish stocks, and and he put it in simple terms for them: no fish, no fish sticks, right? And it's right. So yeah, I mean, healthcare professionals won't be providing doing the things that brought them into the professions if there's no people. So
Yeah. Or we're making the people sicker, right? Because like
yeah,
the stuff that's happening intersects with pretty much, you think of any organ system, like, whether it's respiratory from wildfires, whether it's coronary artery disease from like, you see, worse outcomes when there's heat waves, the microplastics, like there's an article in New England Journal of Medicine finding it in like these atheromas and those people having worse outcomes, whether it's mental health issues, whether you care about social justice,
yeah,
it's racialized and lower socioeconomic status communities that are affected by this. Whether you take that and look internationally and say low and middle income countries are more affected by this, it's whether it's lower birth weights, preterm labor, like it intersects with everything. And so it's yeah, like I think it's like you said at the very beginning, in terms of doing no harm, this is all part of it. And
yeah.
so, um, yeah, I'm hoping, and I see more and more, people are doing just, cool stuff in this area.
Yeah, I can see your role in all of that. So you talked about in terms of your network of hospitals here in Ontario and your role within that. I mean, and making pitches. So I mean, what is the pitch? What's your elevator pitch, right? To get anybody to as you said, if you had to make a choice between anything, like why is this the thing?
Yeah. And so, it really comes down to, again, based on evidence, climate change and the triple crisis we're facing, the number one threat to the health of humanity. And that if we are trying to look after people, then we really need that lens. And if we are not including planetary health in the vision and mission of whatever organization it is, then that vision and mission is irrelevant. That's
Yeah,
it.
simple. Um, so what's next for you, Hussein, in terms of the road ahead?
Yeah. I think right now, an important part of all this is research. We're trying to get a planetary health research lab going here. Going to continue to work again with the Royal College, trying to make sure that our educational pieces are in place to support programs across the country. So again, with Cascades, we're launching fundamentals of planetary health kind of module. Like, so when I went out we spoke to all the post grad deans in the country and also a lot of the specialty committees. And what we heard was people wanted two things. They wanted kind of like what is planetary health? Kind of like this kind of like, what is it? Like, what can we do? Like, why does it matter? And then they want more specialty specific stuff, right? Like, I mean, a surgeon in training may want to know different things than, let's say, someone who's going to be in a family medicine office. And so again, with Cascades, we put together this scientific planning committee through the Royal College. And actually, based on our research, we know that like this has like it's a system thing, like you mentioned earlier. So it's not going to be just physicians. So we actually, there were pharmacists on that committee, there are dietitians on that committee, physiotherapists, nursing, and again, I have to give full credit to Cascades for all the heavy lifting on creating this amazing module. But like for example, we've kind of concluded all that, got all the feedback, and this July, so we're in July, it's going to launch hopefully, and so that's going to be, and we made sure it's also going to be accredited for continuous professional development. So for people in practice as well, it's really useful. So it's kind of stuff like that where we can hopefully get something like this out, educate more people. What's the next step in education? So that'll be the Royal College work. How do we get it out to people who are already in practice? How do we, for those 100 medical and surgical specialties, how do we facilitate that? In the hospitals, how do we continue to incorporate, kind of practical changes that are more in line with kind of planetary health practice? How do we keep that going around the country? We have this like AFMC group, like, again, we're looking across the country in terms of all those planetary health leaders in these faculty of medicine, looking at, governance and accountability, curriculum for those undergraduate medical students. And research and even here, like we've designed an undergraduate medical curriculum. We need to get that launched, and so like stuff like so like that. Like I said, there's just so much to kind of do and keep on doing. But I think if we can keep on scaling this stuff up, like with the Royal College, for example, there's other Royal Colleges. So can we come together? So I've met with the Royal College in the UK, and with the Royal College in the UK and the Royal College of Australasia, now we've tried to put together this kind of position statement saying like, well, hey, every Royal College should, kind of care about this. Can we put together maybe a scorecard of stuff that every Royal College should be doing for this? So things like that. And
Yeah.
so how can we just keep on pushing this is basically what's next. I wish I had a better articulated way, and maybe I need to sit down and really put down on paper what I want to do in the next kind of couple of years. But those are the things that come to mind right now.
Well, I think you're involved in a lot of things, and I guess from my own lens on what you've been sharing with us here for the conversation here today is that I mean you embody, I guess, what a leader can and probably should be doing, which is harnessing the energies of those people around you, clearing the paths for them so that their ideas can sort of be nurtured and flourish. You know, providing a vision, right? Giving them energy, and getting out of the way in some respects, probably, right? But keeping it simple. I think the fact that you're involved in so many different things, I think, is a testament to your passion, but also your leadership approach, which I think others can model and learn from.
Thank you. That means a lot coming from you. I appreciate it.
So yeah, I've really enjoyed this conversation, Hussein. So anything else, I guess, that you would like to sort of end with here before we say goodbye?
I mean, I just want to thank you again. And Chuck is in the background working on sound. Thank you, Chuck. I really enjoyed this. And honestly, if people are interested in this area and they want to chat more about this, I'm happy to connect with anyone. And my email is easy way to contact me, hmoloo@toh.ca. You want to talk planetary health? I'm totally happy to do that.
Awesome. I really appreciate the generosity of the conversation today. You sharing that information. We'll include all that information and anything else that you want to share with our listeners in the show notes. So please check that out afterwards. And yeah, I look forward to continuing to watch the great work that you're doing, Hussein. And thank you for caring about this so much for us all.
Great. Thanks, Dale. I appreciate the conversation.
You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.